So good afternoon everyone. My name is Marva Sumawa and I am your nurse trainer for today. So for today, we're going to discuss about hand hygiene. Okay, so whenever you have question, you may raise it for later and then we will going to answer it for some enlightenment. Okay, so clear? So let us proceed now. So let's define first what is hand hygiene. So, hand hygiene is the most single effective action to reduce healthcare associated infection. So, we have so many different or various infection that we can acquire in the hospital, or what we call the nosocomial infection. So just like for example the streptococcus pneumoniae and E. coli, so those are the example of the infection that we can acquire in the hospital. So um, this infection can be prevented through hand hygiene. Okay, so also hand hygiene is a general term referring to any action of hand cleansing. So for example, you do the hand washing or any action that cleanse your hand is also and considered to be called as a hand hygiene. Okay, so let's move to the next. So, what are the indication for hand hygiene? So, it says here, use an alcohol-based hand rub for all clinical situation where hands are visibly clean. So, when your hands are clean, okay, so you can see it as a clean hand, okay, so you can use only alcohol. But wash with soap and water when visibly dirty or contaminated with proteinaceous material or visibly soiled with blood or other body fluids, or if exposure to potential spore-forming organism is strongly suspected or proven, or even after using the bathroom. So these are the indication that you're going to wash your hands with soap and water when it is visibly dirty, okay? Visibly dirty with blood, okay, and other body fluids. So when your hands are clean, okay, just use alcohol-based hand rub. And when your hands are visibly dirty with body fluids and blood, okay, you have to use soap and water in washing. So, how we will going to wash our hands with soap and water. So, these are the steps that we are going to follow in washing our hands with soap and water, of course. So, number one, you have to wet your hands with clean water, running water. It's up to you. It's either warm or cold. Turn off the top and apply the soap. So, we were going to apply the soap. And then next one, lather your hands by rubbing them together with soap. Okay, so we will going to rub it. Okay, next one, scrub your hands for at least 20 seconds. Okay, and then after, rinse your hands well under clean running water. Okay, so you're going to rinse your hands in a water. Okay, for alcohol, these are these are the step. Okay, so alcohol solution containing 60 to 80% alcohol are most effective. So 60 to 80%, just to be sure. Okay, it has been well established that alcohol effectively reduces the bacterial counts on hands better than soap and water. Alcohol-based hand rubs are more effective against most bacteria and many viruses than either medicated or non-medicated soap. So, how long should an alcohol-based hand rub be applied? Okay, when using an alcohol-based hand rub, apply a dim-sized amount of product in the palm of one hand and rub it together, covering all surfaces of hands and fingers until are dry. So this is usually takes 15 seconds. Okay, so we're going to rub, okay, the surfaces all over of our hands for at least 15 seconds. When we are using alcohol. So next one, we will go to the 5 moments for hand hygiene. So when we will going to wash our hands, okay? So here it says here, before any procedure, aseptic procedure, you have to do your hand hygiene. Okay, next one is after body fluid exposure. Of course, after doing our procedures, like for example the catheterization, we have to do as immediately the hand hygiene. Okay, we don't know if the blood splashes in our gloves, we don't know it. So better do our hand hygiene for safety purposes. Okay, next one, after touching a patient, yeah. And next one, after touching patient surroundings. So for example, you're going to leave the patient's room, you touch the doorknob, and then outside you do your hand hygiene. Okay, and so this is the famous placard or sign cards for the 5 moments of hand hygiene. So says here, number 1, before you touch the patient, hand hygiene. Number 2, before procedure, after procedure. Next one is after touching the patient. And number 5 is after touching the patient's surrounding. So that ends our discussion. Any question regarding hand hygiene? Okay, so if we have no questions, okay, so that ends our discussion. Thank you for listening and see you next time around. So again, I am Maribel Sumawang and I am your nurse trainer. Bye! See you around!